Welcome back to more Whiskey Politics. I'm Melissa Premonitis, sitting in for Dave Sussman again, and once again, we're talking with Dr. John Crisler, world-renowned specialist in men's health, and he's going to tell us a little bit more today about his practice and the kind of patients that you treat.
Well, I provide hormonal optimization, which is largely testosterone replacement therapy. We now know that testosterone replacement therapy decreases the risk of having heart attacks and strokes, and it does not increase the risk of prostate cancer or make prostate cancer spread. Irrespective of what most physicians think, the evidence is pretty clear that we've been wrong about this for many, many years. I do thyroid optimization. I do that for females as well. We treat stress hormones, diet, exercise, all the stuff what you would normally think of being part of aging. About half the men at the age of 50 have low testosterone. And that increases your risk of heart disease, diabetes, osteoporosis, depression, Alzheimer's disease, and sexual dysfunction. In fact, now with the constant assault from environmental toxins and frankly poor lifestyle, about a third to a quarter of the men at the age of 30 have low testosterone. And so that greatly increased risk for not only poor health, but a poor life. And the guys get a little bit older, and the kids leave the nest, and they have no longer interest in romance. That's not the life that their wife or their partner was planning on. So it caused a lot of problems on the roof as well. I get a lot of thank you notes from wives.
So with the kind of medicine that you practice, this isn't something that's covered by insurance very frequently, is it?
Well, I have a cash-only medical practice because we wouldn't be able to survive if we had to fight with insurance companies all the time. But the patients we provide them with a super bill, and the patients can give that to the insurance company. Also, they can use an insurance card to pay for the labs or medications usually. Compounded medications are sometimes covered by insurance, that helps, but compounded medications are much less expensive. And they do give us access to medical coverage you wouldn't otherwise have. A lot of medications that we use in my field of medicine just simply are not available out there otherwise unless you use a compounder, so that helps out a lot.
Now, I saw you in Las Vegas just recently doing a speech in front of a huge room full of doctors who basically mobbed you afterwards with questions. How long have you been training doctors?
Well, I started my practice in 2002, and I found myself 2 years later standing on stage at the Royal College of Physicians in London, the world's oldest medical society. Didn't take me very long to realize that talking about my field of medicine was going to get me up and around the world and have a lot of wonderful experiences and also be able to help a lot of people. I've personally trained thousands of doctors around the world in the techniques that I use. Now, this is a form of medicine. This is something we need to be doing. The restrictions against, for instance, testosterone replacement therapy, we now know should never have been there. Testosterone replacement therapy actually decreases the risk of having a heart attack or stroke. It does not increase the risk of prostate cancer. In fact, the men who have low testosterone are much less healthy from many standpoints and much less happy, and so are their partners. We always have to think of the partners as well.
How did you get interested in this?
Well, I'm a former bodybuilder, and I took anabolic steroids when I was a bodybuilder. I still like to train. I just have to every day. But I wanted to actually treat bodybuilders for the ravages of steroid use. I've never prescribed an anabolic steroid, and I never will. But I wanted to treat the bodybuilders. What I found out is they'll spend $500 a week on drugs, but they won't spend $50 for an office visit. So, but because I knew about the hormones and knew personally how they feel in the body, I know what it feels like to have very high levels of testosterone. I know what it feels like to have very low levels of testosterone. So it gives me an empathy with my patients. I thought it I would say the field of medicine found me more than I found it. I went to my first medical conference, and by the end of the day, found myself on stage with a panel of speakers answering questions from the crowd. So the personal experience I got and just being really interested in it. So I left internship and went directly into practice. I'm told I'm probably the only general practitioner that year that started out doing that. I would not recommend anybody else skip their residencies. But I just basically hung my shingle up and pronounced myself in practice and started cash-only practice and began treating hormonal dysfunctions in men. So, of course, I have a few female patients I do well. Thyroid is the same in men and women. Stress hormones the same in men and women, but I don't do anything with sex hormones in women. But testosterone replacement therapy for the men, and it's just been a wonderful, wonderful career.
Now, you've talked in the past about the blood-brain barrier and how testosterone affects men's mental attitudes. Can you talk to me a little bit about that?
Sure, great question. Testosterone isn't just a body hormone, it's a brain hormone as well. And it's very important for the brain to function properly, to have enough, not just for sexual function down below, but for mental cognition function above. The brain just doesn't work well in low testosterone men are depressed, weak, impotent. It's just a very, very poor quality of life. So.
And when you give them testosterone, do you start with a small amount and then keep going up until, or do you have really specific paradigms? Not paradigms. Do you have
treatment protocols? Yeah,
protocols.
Well, it's very patient specific, and that is really what we're training our doctors. We have to teach them. It's extremely patient specific. It takes a lot of experience to really do it well. Some men, there are different modalities. Some men might want a testosterone gel. Some men prefer shots. If sometimes you start on one, go the other, but generally you do start low and go slow, so we don't overshoot our target, and just kind of walk people in on it. We have to manage testosterone, we have to manage estrogen as well. There are female sex hormones in men, and they can be a big problem for guys. As guys go up in age, they tend to increase the amount of estrogen that they produce, or female sex hormone. That causes sexual dysfunction and impotence, I should say, and depression and weakness and fatigue and so forth. So managing estrogen is part of it as well.
So what is the picture of the kind of patient that you would see, the patient that's pushed into the office by his wife or his partner, and what does he look like, and how does he present to you as a physician?
Well, it used to be mostly 50, 60, 70-year-olds, and we're seeing across, my colleagues will tell you the same thing, they're seeing younger and younger guys. There are the hormones in milk, the sex hormones in milk, the industrial and environmental assault from estrogen-like substances, plasticizers, poor diet, lack of exercise, and so forth. Now we're seeing guys now, it's really common for me to see guys 30 years old. I've had a number of parents bring their young teenage sons to me who are developing. I have them see a pediatric endocrinologist first, but then I come in to manage the hormones. I think of myself as more of a mechanic than an academic.
So what are the typical symptoms that a guy would have that would bring him to you?
Well, sexual dysfunction, lack of libido specifically would be a red flag for low testosterone. And there are guys out there who tell me they go on testosterone the very first day they got their romance back. But fatigue, the difference between men and women is that the guys generally kind of slowly roll down a hill, and then they may or may not notice that they haven't had sex in several months, for instance, or they notice that their weights are going down at the gym, or it's just harder to keep that weight off, or they're feeling fatigue. They before would work well into the evening. Now they're pooped out by the middle of the afternoon. And every man who's become successful will tell you it's what he did after 5 p.m. that got him that way. So they tell you that his golf shot is now 40 yards shorter. If I can figure out how to fix a hook and slice and testosterone replacement therapy, I'll really be onto something. But
now you had an episode. You had a real health scare not that long ago. Yeah. We've got some photographs of you right afterwards, which I'd love to show. And want to hear you tell the story about it.
Well, I just had my 50th birthday and was, of course, bragging what great shape I am and feeling like I was never going to die. And then 5 days later, I had a massive heart attack. I had, with no symptoms beforehand. The day before, I swam a quarter mile nonstop without any symptoms. That morning, I just got done having a really strenuous leg workout, and then all of a sudden I started to pick up the phone to call my first patient, and I felt like an ice pick between my shoulder blades. Over about the next 15 minutes it got worse and worse, and then I had to call the ambulance. I had to do my own CPR for 45 minutes. By doing what I did, I was able to prevent any damage to my heart whatsoever, even though the right side of my heart was completely blocked off from blood for about an hour and a half.
Wow.
And I could tell you that feeling when they put that clot buster in, that clot breaks loose and half your heart gets blood when it's been starved for an hour and a half. It's about the best feeling you'll ever have. So my cardiologist came in that night, and I'm just sitting up in bed smiling, unlike the rest of the patients in the cardiac intensive care unit. There were some very sick people there, so I wasn't wanting to take up the time of the staff very much while I was there, and also wanted to get out of there at doing $25,000 a night. So cardiologist came in and said, we can't figure out why, but we can find no damage to your heart anywhere. It's because I was basically doing my own CPR for about 45 minutes to keep the blood returning to my heart. So I got out the next morning, the stent was in place, it wasn't going anywhere. So I caught a ride home and changed my clothes. I went to the gym and got on the treadmill, and I ran 1.1 miles at a 10-minute pace 28 hours after having the massive heart attack that should have killed me.
Wow.
Without any problems whatsoever. No chest pain, no shortness of breath, lots of sweating. I was running good, but really no problem since. And the picture, we had photographic evidence. The picture shows me, you can see the bandage on my wrist for where they had the access for the stent. Fortunately, it was in my wrist instead of through my groin. The groin would have been a much different situation, obviously. So, and since then, no side effects.
Now, to what do you attribute this? Do you do testosterone therapy?
I am on testosterone replacement therapy. I have some unique hormonal situations, and so in learning to manage my own hormones, I learned a lot to help my own patients, and certainly a certain amount of empathy goes along with that. I know what guys feel like when their testosterone is very low, so that helps to have more empathy with patients always. But my testosterone and my other hormones are tuned up perfectly. I'm 58 years old. I really never felt better. 1 month to the day after that heart attack, I ran a 5K race and got my first hardware. That means I placed for the first time, and it was the Susan B. Komen breast cancer survivor race here in Lansing. And so it was a bit of a survivor race for myself because it was 1 month a day after having my heart attack, and placed third. So the first time I ever placed in a race.
Wow.
Yeah.
That's remarkable.
Yeah, this having a heart attack and not training is really doing a lot for my running, no question about it. It's working.
Now, if someone wants to reach you and talk to you, they're able to talk to you without ever having seen you face to face. Is that correct? You have
Well, great question. By law, I have to see a patient to prescribe for them. That's just the way it is. Unfortunately, hopefully telemedicine will change. There are a lot of physicians offering telemedicine without seeing the patients first. That's concerning, and definitely they're at risk for severe regulatory interference for doing so. But patients come in to see me one time. We have patients in all 50 states, and then they go home and I follow them remotely after that. My guys will just make a day trip out of it to come in and see me, and then I follow them remotely. But we find there's so many guys around the country who just don't have access to the medical care that they need, that I've offered what I call my advice-only consult, where they can get half hour with me. I'll tell them what labs to order, and we can actually arrange for them to get their lab work done. And they'll interpret their labs for them and make suggestions for their medical care, and they can take that back to their own doctor and get the treatment that they need, or however they're doing it. But basically, we feel the advice-only consult is a pretty good service for people because they can get information otherwise wouldn't be able to.
Very good. Well, I have all the information for contacting you on the screen right now, and so if someone wants to contact you, they can. And I'm sure that actually folks at Ricochet are going to be very interested in learning more and asking questions. And I think that you have joined Ricochet, is that correct?
I am.
Another happy member. So we'll be seeing you online soon, I hope. And thank you very much for talking with me again.
Thank you, Melissa. Glad to be with you.